Now, why does PCO affect fertility? PCOS affects fertility in 2-3 ways. One is because there is no ovulation, so no egg is being released. So obviously pregnancy cannot occur. So spontaneous pregnancy becomes very uncommon. It may occur in the odd scenario, but by and large, that's not the norm, because the ovulation is dysfunctional. So you really don't know when the egg will be released. So there is no way to time the intercourse to plan the pregnancy. Then even if they do become pregnant, it's always a very high vigil kind of situation, because there is increased risk of miscarriage. There is a risk of developing diabetes also. Again, the same metabolic problems that PCO is associated with can also happen in pregnancy. So there is increased risk of developing what is called as gestational diabetes. And also high blood pressure during pregnancy, we call it as preeclampsia. So there is risk of developing both these conditions. In addition, if their sugars are very high, there may be associated fetal anomalies. Then there is a risk of preterm birth. Again, macrosomia, something associated with high blood sugars. And with all of these, there is a higher chance of having a cesarean delivery and sometimes even perinatal morbidity and mortality. PCO, so one aspect is an ovulation. The other aspect is the ovarian quality or the oocyte quality is also suffers, because there is ovarian hyperandrogenism and hyperinsulinemia. So there is a premature luteinization of the granulosa cells. And then there is some other paracrine dysregulation also. And so that's why the maturation of the oocyte is impaired. So the follicles will not grow as well as they would normally if the hormonal milieu had been completely normal. So the growth of the follicles also gets arrested. And that is where the drugs which help in fertility come in. What they do is they will help the follicles to grow. So more follicles are recruited. They help in also the growth of the follicles by trying to normalize the hormonal milieu. The contraceptive ones will just create a baseline state of hormones. They will stop ovulation, but they will not let the abnormal androgens rise. So they will correct the abnormality in that way. And the fertility enhancing drugs will help in the growth of the follicle and then help to keep the PCO at bay, because then only the hormones which the growing follicle releases will be released. So when does one think of starting treatment in a person from fertility point of view for PCO, in PCO? So one most important aspect is the age. The second is the duration of marriage. And the third is, are they actually having infertility? And infertility is not that somebody got married 3 months ago, tried for a baby for a month, and now they can't conceive and they know we are PCO. So now they have infertility. No, infertility textbook wise is defined as no pregnancy despite 1 year of unprotected intercourse. So if a couple has tried for a whole year and have not been successful, that's when they would be labeled as infertility. Of course, this changes slightly if the age of the lady is more than 35, you don't have 1 year to give, because you know that fertility will also decline with age. So at the end of 6 months of try, one may intervene. And of course, these days it becomes relevant and more kind of pressing to intervene when the patient knows they have a problem and they're very, very anxious. So if they come to you straight away, I have PCO, I want to become pregnant as early as possible, then you can't say, okay, go back, come back after 1 year, you haven't hardly tried. No, then when they know and they're very anxious about it, that's also a point to intervene.